Alrighty, welcome. I see at least one attendee logged in, so we're going to give folks just a few minutes to get settled and not registered, you're already registered, but logged into the Zoom. So we'll get started here in just a moment. All right, wonderful. All right, so we have a few folks here joining us. So we are going to get started to be mindful of everyone's time today. If you have questions, we really encourage interacting with us. Every applicant is pretty individualized. And we will, kind of get started. So I'm going to hand it off to Adam and he will get started the session. But my name is Joanna and welcome.
Hi, folks. My name is Adam. I'm one of the admissions counselors here who works with the Worcester, Manchester, and online offices. Thank you so much for joining us today. So we'll get started like Joanna said. So, first and foremost, congratulations on your decision to pursue a career in healthcare. Right now is a great time to get into healthcare. The field is in high demand, and we have an aging population, so the demand is projected to increase over the next several years. As you can see, the U.S. Bureau of Labor Statistics states that 1/3 of all new jobs through the next year will be in healthcare industry, which is fantastic. And with that being said, our students here at MCPHS are finding job placements soon after graduation, and some are even finding them before they even graduate, which is obviously fantastic for our students. And not only does the field of nursing have a very strong projected job growth, but it also ranks upon the top 30 healthcare careers according to the US News and World Report. So we realize that returning to school for your degree will be an investment of both your time and money, but based on the current job outlook and the quality of education we provide, we do believe that this is going to be a really good investment for you and your resources, and that will have a great return on investment for you in this going forward. So few fun facts for you here about MCPHS. We are a healthcare specific university. We offer over 100 different programs in different fields. So healthcare is what we do. We are very familiar with the healthcare industry. It's fantastic. And it has been around for a long time. Specifically, we've been over 200 years. We celebrated our 200th anniversary in 2023. We are one of the one of the oldest institutions in Massachusetts, and we were started as the second pharmacy school in the United States, which is fantastic. And with that, we have a diverse population, over 7,500 students between our three campuses and the online branch. Again, healthcare is our specialty, and many of our faculty are still working in the healthcare field while they're teaching, so they are well versed in course material and are constantly staying up to date on the current healthcare system, which is fantastic. And through school-sponsored events and other social activities, our students are able to learn a lot about healthcare professions even before entering the field. Lastly, we do pride ourselves on maintaining clinical affiliations with some of the leading medical institutions in the nation. We'll touch on this in a few more slides, but of course, Massachusetts is a great leader in healthcare. So a quick glance at each of our campuses. Our Boston campus was founded in 1823. This is, again, the largest and the oldest campus. It is located near the Longwood Medical Area, which is surrounded by several of the well-known healthcare facilities. A majority of the programs we offer on this campus are undergraduate, and such as nursing, but we also do offer a variety of graduate, doctoral, and certificate programs here too. University-sponsored housing is available for students on the campus, and we do focus on undergraduate students for that. Our Worcester campus, about 40 miles west of Boston, so Worcester is home to our second largest campus, and it was founded in 2000. It is the second largest city in New England, which when I moved here was my favorite fun fact to tell everybody. And it is a fast-growing hub of innovation. NPR recently deemed Worcester as the new IT town, which is very fun. You'll find healthcare right here at your fingertips. Even from right outside the doorsteps of our Worcester campus is St. Vincent. It's fantastic. We also have UMass Memorial Medical Center, which is one of Massachusetts' largest integrated healthcare systems, and it's right down the street from where we are, which is fantastic. All the programs we offer on this campus are either graduate, doctoral, post-baccalaureate, transfer programs. So it's a very professional part of the program focused university. And we do have housing opportunities for all students on this campus. So we have enough housing to guarantee that you have a spot, which is fantastic. And then we have our Manchester campus. This was founded in 2002. It is located in downtown Manchester, New Hampshire. It is the smallest of the three campuses, so it has a really nice, quiet New England town feel to it, even though it is still a city in New England. It is only about an hour north of Boston and Worcester campuses, and absolutely within driving distance to several healthcare facilities in the state of New Hampshire, including Elliott Hospital, Concord Hospital, Dartmouth Hitchcock Medical Center, and many more. We offer post-baccalaureate, graduate, and doctoral programs on this campus. And we don't have on-campus housing, but there are off-campus housing options that we are able to assist you in finding, which is great. So our university has a reputation that it is dedicated to the success of our students with an immersive hands-on culture. Starting with our interprofessional education, also known as IPE, at least once per semester, students participate in IPE activities where they engage with students in other programs. For example, BSN students might work with pharmacy students, and this is a really great way for students to learn about other healthcare professions, how to work with patients from other cultures and backgrounds, and functions of team members and how to work as a team once employed in the healthcare system. Knowing that you are not going to be in a silo of just nursing 100% of the time, you're going to be collaborating with others in the healthcare professional. Maybe you're going to be working with sonographers, doctors, and so you're going to need to know how to interact with those other team members on one healthcare system. It really prepares you well to work in the healthcare industry. We also have hands-on supportive faculty right down the hall from where students have class and lab in each academic building. They do have scheduled office hours, but are often available to help with any questions throughout the day as well, of course. And then we have resources through our Center for Academic Success and Enrichment, also known as CASE, which is to help students who are struggling academically. There are peer tutors and mentors available to students, and it is highly encouraged that you take advantage of their resources there. It is not looked down upon at all to be looking, going to CASE. We often have students who identify themselves as frequent flyers of CASE because they are able to take advantage of those resources and advocate for themselves and find the right path forward for them. It's fantastic. And then we also do offer on-site counselors for mental health emergencies and wellness, as well as the Center for Career Services, where they assist with resume writing, mock interviews, and of course the job search. And then apart from academics, we have options to join nursing-specific organizations such as the National Student Nurses Association, Nursing Students Without Borders, as well as cross-programmatic clubs. So this may be a very busy program, but there are plenty of opportunities to get involved in things like student government, campus activities, fundraisers, drives, etc. So a little bit about our nursing program highlights. So we have our two undergraduate nursing programs. We have the post-baccalaureate BSN and then the accelerated BSN. The post-baccalaureate BSN is offered on all three of our campuses, Boston, Winchester, and Manchester, and it has a fall and spring start. And this is a 16-month all year round program. So it'll be 4 semesters. If you start in the fall, spring, summer, fall. And if you start in the spring, spring, summer, fall, spring. And then the accelerated BSN is located just in Boston, and that is 32 months, and it only starts in the fall. Of course, we also do offer some graduate nursing programs. Specifically, we have a family nurse practitioner, psychiatric mental health nurse practitioner, and then a bridge MSN program, and the doctor of nurse practitioner. So those are great. And those are all offered online as well. Right. I'm going to pass this over to Joanna now.
Thank you. So with all of our nursing programs, I think one of the key pieces is that we are one institution and we are one nursing program. So our curriculums are the same across all three campuses when we look at our professional nursing classes. So we've really perfected the art of preparing you for that NCLEX examination, preparing you for clinical rotations, and you'll see access to that at all three of our campuses. We have state-of-the-art facilities. It's kind of a little bit of what we're known for. All three campuses have simulations where students will work on quite heavily in their first 6 weeks of the program as they get ready to go out on clinical. And as they do more clinical rotations, that time in the simulation lab reduces as you gain your skill set in the patient assessment and so on. We use a lot of technology in the classroom to help support what you're learning in clinical. We do a lot of online support in the form of tutoring, faculty access. So if you are on clinical and you need help at night preparing for an examination, our faculty are very hands-on and are offering Zoom study sessions to support all students. Our clinicals are next to none. Across all three of our campuses, we are in large metropolitan areas where you have some of, if not the best hospitals and healthcare facilities in the United States. And we have clinical sites basically at every location from Boston to Worcester, up north to Manchester. So great access to really premier facilities. Also access to smaller facilities where you're able to do a little bit more because less folks are there. And so you get a really nice balance of that large teaching hospital or premier healthcare facility to smaller hospitals where the nurse maybe does a little bit more of kind of the list of things to do. Net NCLEX preparation is important for anyone going to nursing school. We boast, depending on the campus, anywhere from 96% to 100% first-time pass rate, depending on the three campuses. It is something that we've really perfected at this point in time to ensure you have all that you need to pass your licensure examination. So to talk more about clinical experiences, I think this is something that we get asked the most about. You do clinicals in all 4 semesters of the professional nursing program. Your first semester of the professional nursing program, whether you're a transfer student on the Boston campus or a freshman in Boston to a student starting in the post-baccalaureate nursing program in Worcester. That first semester, you spend the first 6 weeks in the simulation lab every single day. You are building your skills and your confidence in patient health assessment, head to toe physical examinations. And then on week 7, you go out on your first clinical rotation, which tends to be in more of a community health, VA home type center as your first rotation to really gain confidence in that patient interaction, doing the less fun things that some folks consider, daily activities of daily living, helping folks bathe, go to the bathroom, the unsung hero awards, I would say, for nurses in those items. Semesters 2, 3, and 4, your clinical rotations expand into med-surg and programmatic rotations, such as women's health and OBGYN, specifically labor and delivery. You do pediatrics, you do a psychiatric rotation, and you're doing more hours on rotations and less hours on campus. And so you'll see kind of the pendulum switch of on campus a lot at the beginning as you're learning and building your skill set. Towards the end, you're off-site on clinicals more and on campus less. Our clinical experiences are guaranteed. This is something that is super important to MCPHS. Every placement you need to graduate to sit for board licensure exam, we ensure you will have. We have a pretty robust lottery-based system when you are selecting clinical rotations where you will indicate your top 3 rotations for maternity. And then you will be placed within those top 3. Another question I get asked a lot is how far away could these rotations be? It's typically an hour radius from your home campus. And something that the faculty take into account in clinical placements is, do you have a car? Does someone who is on this rotation have a car? Is it near public transit? If it's none of those things, the university has a van that students can access to be able to get to and from campus and their clinical site. So there are a lot of supports to ensure that you're able to get there. I think it's something really reassuring to know at the end of the day. All right. So always apply. If you have classes in progress or you're waiting on grades from the spring semester, submit your application as soon as you can. It's free to apply for any of our undergraduate nursing programs, the post-bac program or the accelerated program. You'll submit the free transfer application. With that, there is a short essay of why you want to be a nurse. Nothing to overwhelm and stress yourself out about, but something that's included with the application submission. Outside of that, we're looking for all college transcripts from all places attended. You can actually upload these unofficially into your portal. If you would like, we can review and make admissions decisions on unofficial transcripts. We'll just need the official transcript down the road before enrollment. Depending on the campus you're applying for, you will see possibly your admissions checklist will require a high school transcript or not. That's going to be an added item once you submit your application based off where you're applying. With all of these items, we are able to review your application within a 2-week timeline for admissions. There's a couple of if, ands, maybe this. So if you are an international student, we do typically need a WES or an ECE evaluation. I would be in contact with us. We have a very robust international admissions team that can help us in translating and help with, guiding you through that process. Also, if you're a transfer student, we do require the TEAS examination. So that's something that we can help you through. There's some rules and regulations about the age of the TEAS score, but that's a great kind of connection point for you to meet with us so we can guide you through that process. All right. So students who are applying with a degree earned, the prerequisites are very set in stone. You'll see that you are needing to take a range of sciences, statistics, and human growth and development. Human growth and development is life cycle. It's covering the life cycle. So I've seen it titled developmental psychology, lifespan psychology. And so we're looking for a course that covers basically birth to death in that area. The sciences do require a lab, so that is typically 4 credits in a traditional semester-based program. You can apply with some of these classes in progress, so you do not have to have them all completed. We are just looking for a realistic timeline for them to be completed. So if you're applying right now for the fall, you'll want to have the majority of these completed or in progress to make sure it's a realistic timeline to have them completed before the start of the program if you're accepted. We do offer these classes online through our School of Professional Studies that are self-paced online courses. And you do get a discount off the first course that you register with them. And then if you are accepted and deposited, you do get half off all remaining courses that you take through the School of Professional Studies in regards to the prerequisites. All right. So a lot of details in small font here. My biggest message here is if you are applying to any of our campuses without a bachelor's degree, amazing. Send us your transcripts. We're going to confirm what you need, what you've taken, and make sure you're on track. Most students applying to our programs, specifically Worcester or Manchester, do need to have a large amount of credits completed. It's about 55 credits that you do have to have completed, prior to enrolling. So typically that's close to an associate's degree or about 2 years of college coursework. You'll see we're looking at very traditional college courses for a baseline proficiency with Englishes, maths, and then those general education requirements that you see with psychology, sociology, and liberal arts classes. We're here to serve. So give us your transcripts. Don't try to self-identify. We'll get you every answer you need very clearly so you know what you need moving forward for a future application or to submit your application for today when it comes to prerequisite requirements. All right. Adam had mentioned earlier, we do have some really great on-campus housing options. University-sponsored housing is located on the Boston campus and on our Worcester campus. It's really convenient. Most of the towers on both of the campuses are attached to many of the academic buildings. So you go down an elevator and you're in class. They have, all of the things you would expect a university sponsored housing program to have with public safety, 24-hour, security. We have across the campuses, many access to really great athletic, I shouldn't say athletic, excuse me, fitness centers that have access to different athletic items like weights, running, those types of things. They are very competitively priced for city living as well, so that's something to definitely explore with your admissions counselor. Living in a large city is a lot to take on when it comes to moving and finding an apartment, and that's cool. We can help you either way, on campus or off campus. We can help answer those questions. The on-campus option is really just uncomplicated. You just say, I want to live on campus. We help you through that process, and you have a spot. That gives you some time to get acclimated with the city that you're living in, and then decide to live off campus for future semesters if you'd like, or stay on campus for the duration of your program as well. All right. Scholarships and aid. This is super important in today's day and age when we're looking at affordability. Adam spoke greatly about the return on investment. You guys have picked nursing, which is a great and lucrative in-demand career, so we don't need to sell you on that part. I think what we're looking at supporting you is putting together that financial plan to make your second degree or transfer degree in nursing possible. We do consider all applicants, no matter what campus, which nursing program, for the undergraduate option for an automatic merit scholarship. This merit scholarship ranges, and depending on the campus you're applying to, you'll automatically be awarded that if you're accepted. So that's first and foremost free money that you've earned based off your academic achievements. Outside of the merit scholarship program, we offer, or we process the FAFSA like most universities here in the U.S. All U.S. citizens and domestic students can fill out the FAFSA and be considered for federal financial aid. Depending on your academic background, if you already have a bachelor's degree, that's going to impact what you're eligible for. And so our biggest message is apply and submit the FAFSA really close to the same time so we can give you a full breakdown of your FAFSA eligibility. With that, we do a lot of financial education around our programs because you're committing for another 4 semesters, maybe more if you're coming in as a transfer student in Boston. We want to make sure you have a financial plan for the duration of the program. And what does that look like? How can we support you? What are those payment options? And we like to call them affordability appointments or financing appointments, where we will sit with you through Zoom in person with you and your support system to really outline that overall cost, out-of-pocket costs, and what those payment options are for you. There are priority FAFSA deadlines that we, definitely encourage trying to meet, but if it is after this deadline, obviously it's after March, still apply. There is still federal financial aid available, so it doesn't mean you've missed out on everything. So still submit that FAFSA if it is something that you are hoping to do. Great. So I gave you homework: apply, submit the FAFSA. Next would be visit the campuses. Once you have a campus in mind that you would like to attend, all 3 of our campuses offer tours. You're able to use the cool QR code function, which I love, to register for a visit if you'd like. We also offer one-on-one counselor appointments through Zoom or in person, just to support you through the process. Not to sound like a boomer, but also our YouTube channel has some really great videos around labs, campus facilities, dorms, all of those things. So if you can't make it to the city or one of our cities, our YouTube channel is super, it's helpful to just get an idea of who we are, where we are, and what our facilities look like as well. All right. So contact information, take a photo of this slide. Really, at the end of the day, anyone you reach out to will be able to support you through this process. We have set admissions counselors on our various campuses that specifically review these applications and kind of are your main point of contact once you're accepted. And so Michaela is absolutely wonderful. She oversees Manchester and Worcester's campuses, and then Christine oversees our Boston campus. So at the end of the day, anyone can help, but this is a great kind of starting point of contact. Right. So Adam and I really power spoke for about 30 minutes. We're going to pause here to see if there are any questions from our attendees, and then from there, we'll kind of wrap it up for the evening. The chat function should be working. I did test it out earlier if you do have any questions. A kind of a rapid fire of important things to take away as we wrap up. If you have classes in progress, we still strongly encourage you applying. It is something that is not an on or off. If you have classes in progress, apply. We're still able to consider you for admissions. If we need to wait for grades or anything like that, having the application in allows us to really directly coordinate that with you. Also, some of our campuses are close to a wait list for the fall. And so the earlier you apply, the higher you are on that wait list, which is really important if your goal is to start in the fall as well. But it doesn't look like we have any questions coming through. So at least here in kind of central Massachusetts, it's a beautiful sunny evening. So we hope you guys have a great night. Enjoy the weather. And thank you for joining us.
Really quickly, we did get one question,
Oh,
which
you
is in the Q&A section. It's
ah,
how many of your post-bac students are older slash no longer in their 20s?
I would say it's probably about half. It varies from campus. Boston skews to being younger because we have a full undergraduate program in Boston. But I will say we have so many career changers in the post-bac program. Many students are 25 plus, if not older, who are coming doing a full career change. So it's definitely very common for older students in the post-bac program. Sorry, I didn't even see that little bubble pop up.
I had to go searching for it. But also on that note, is that's one of the great things I've noticed about our fast track programs, as as well as our post baccalaureate programs. I work with the diagnostic medical sonography programs often, and again, we see a lot of career changing and a lot of older students returning to school, which is fantastic. So
Yeah, it's a big part of being in healthcare. We see students of all walks of life, all backgrounds. I see students with marketing degrees, art degrees coming back for nursing. And so there's no set background or requirement to do a career change. And we see that all the time. Awesome. Well, thank you everybody for real this time. We hope you have a great night and thank you again.
thank you. Bye.